Good morning. My name is Dr. Martha Boone, and I'm a private practice urologist in Atlanta, Georgia. And this morning we're going to talk for a few minutes about erectile dysfunction. Now, the diagnosis of erectile dysfunction is the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. This is a diagnosis that means many things to many people. What we're going to talk about this morning are the medical implications. When we look at the model for a male, the male urinary tract, the male genitourinary tract is made up of the penis, the testicles, the prostate. Now, to have a normal erection, you must have three things. You must have normal blood flow into the penis. You must have the ability to clamp down the veins that are in the penis to keep the blood from running back out. And you must have normal neural input. So it's a fairly sophisticated hookup. Now, many things can affect this. Your thoughts, your stress level, your happiness with your relationship or your partner, what the general stress is in your life, what you might be thinking about your work or your finances, can all play into your ability to have an erection. Medical diseases can also contribute to this. If you have heart disease, the same blood vessels that are pumping blood to your heart are pumping blood to your penis. So the atherosclerosis that has affected your heart can also affect the blood supply to your penis. If you have high blood pressure, that affects the blood vessels in all of your body, and so high blood pressure can contribute to erectile dysfunction also. If you have elevated fat in your blood vessels or hyperlipidemia, that can also contribute to erectile dysfunction by narrowing the arterial inflow. Excess use of alcohol or excess use of drugs can also contribute to erectile dysfunction. Smoking contributes to erectile dysfunction by damaging the blood vessels that pump blood into your penis. Any kind of trauma in your urinary tract can also contribute to difficulties. So if you're having this problem, you'll come to a urologist, and the doctor will first of all take a very detailed history to determine which parts of your general health might be contributing to this. If you wanted to do anything on your own to improve your erectile dysfunction, the things that you could do are try to maintain your ideal body weight and try to get some regular cardiovascular exercise. Things like walking, swimming, bicycling for no more than 30 minutes at a time can add to your ability to have an erection. When we're looking at this model of the male anatomy, it is as if we have cut the man in half and we are looking into the body. This is the penis with the erectile tissue. This is the testicle. This area is the prostate. This is the bladder. And this is the rectum. The parts that help with erectile health are arterial inflow to the corpora cavernosa, or the tubes that are on the inside of the penis, the ability to clamp down the venous flow so that it can't come out of the penis, and normal nerve input into the penis to give proper neurologic signals. Now, at the urologist's office, you'll have a detailed physical examination. The urologist will evaluate your genitals, and you'll have a rectal exam to determine if there's anything anatomically wrong with you. If your urologist finds any reasons to think that you might have hormonal problems, the urologist may order testosterone, and they will certainly order a PSA if you're a gentleman over 40. Your urologist might also discuss the use of a vacuum device. What this does is it helps to keep the blood flow in the penis so that it is not running out in the venous system until you're ready to complete your sexual encounter. You can find information about these devices on the internet, or you can get them from your urologist. Another product that has been used is something called a Muse device, M-U-S-E, and this is a small pellet that is introduced into the urethra to encourage blood flow to the penis. There are also compounded agents that you can either rub topically on the penis to increase blood flow, or you can actually inject into the penis using a tiny hair-like needle to improve the blood flow. So far, there are no treatments to improve the neurologic flow to the penis. Diseases such as Parkinsonism, multiple sclerosis, spinal cord injuries, and diabetes can all damage the nerve supply to the penis. Currently, we don't have any way to manage that particular aspect of erectile dysfunction. Any medical problems that you have, the better that they are managed, the more likely you are to have a successful sexual encounter. If all of the lifestyle changes and the medications and the vacuum devices and the injection devices have not given you a satisfactory erection, the last thing that might be done is the implantation of a penile prosthesis. What occurs during this operation is the inside of the penis is replaced with a device that can inflate and deflate at your utilization. There are many types of penile prosthesis on the market, and your urologist can help determine which one might be best for you. In conclusion, your sexual health is a barometer of your general health. So taking very good care of yourself can definitely help improve your erections. Try to maintain your ideal body weight, try to have good nutrition, try to manage your stress and have adequate sleep, and be certain that you're getting regular cardiovascular exercise. If you continue to have problems, you most definitely would like to consult a urologist. Our office would be happy to help you with the evaluation and management of your erectile dysfunction. Thank you.